Hello, my name is Dr. William Park with Bless Smile and Smile on You Dentistry. Today we'll be starting our series on implants and answering some of these questions that you may have about your implant treatments. The topic that we will be talking about today will be why you need a CBCT x-ray for when you're getting implants. So one thing I hear often from patients who are offered implants is, why do I need to get another x-ray or a CBCT scan just to get my implants? Is that x-ray going to be harmful for me? So first of all, what is a dental implant? A dental implant is a medical device that serves as a replacement for missing teeth that gets fixed into your jaw. When placing these implants, there are a number of vital structures in the area, like your blood vessels and your nerves, that we want to take care not to disturb when placing them. A dental cone beam CT scan, or CBCT, helps us to visualize your entire jaw in a 3D image. This helps us to avoid any kind of vital structures like we were talking about before. And it also helps us to visualize exactly how much bone you have in the area so that we can determine exactly where to place that implant so that it could be in a stable and ideal position. However, the dental CBCT scan does not serve as a complete replacement for your traditional x-rays. It will serve more as supplemental information for your dental provider so that he can provide you the most ideal and best care. So is a dental CBCT scan potentially harmful for you? There have been some concerns raised in the medical community about the amount of exposure that a patient receives when getting a medical CT scan. However, there are some major differences between a CBCT scan that we use in the dental office and the CT scan that you would receive in a hospital in a traditional medical setting. With the dental CBCT scan, or cone beam CT, as the name says, makes use of a cone beam. This kind of helps to limit the amount of exposure just to that area that the beam is pointing at, rather than for your traditional CT scan, where the exposure is kind of in that whole area. In addition, dentists will often ask for a limited field of view. This means that it's kind of limited to the specific area that we're working in, rather than exposing the whole jaw or the whole mouth. And again, this helps us to limit the amount of exposure that you're receiving. Studies have shown that medical CT scans give you about 50 times more exposure in comparison to your limited field of view dental CBCTs. Considering that going in a plane from New York to Tokyo exposes you to about 150 microsieverts, a dental CBCT exposes you to only about 38 microsieverts. In fact, in our everyday life, just by living on this earth, you are exposed to about 10 microsieverts. And even more than that, just sleeping next to someone for 2 years or eating 40 bananas, that will expose you to about 40 microsieverts, which is already more than what you are exposed to in a dental CBCT scan. So the 38 microsieverts from the dental CBCT is really not that much. So dental CBCT scans are a great modern tool that we dentists have in our toolbox to make our treatment of you, the patient, even better. These images will help us to place the implants in a very ideal position so that we can ensure their stability, and we can take care to avoid any of those vital structures that we talked about. There are some concerns about the exposure to radiation that you may receive, but these concerns are more applicable to the traditional medical CT scans rather than the limited field of view dental CBCT scans that we talked about. We even offer a mobile CBCT van service, which can go to your work or your home or wherever is most convenient for you, so that you can get the image done and you are ready to start your implant treatment. So today we talked about why a CBCT scan is necessary when you're getting some dental implants placed. And we talked about the safety regarding them. If you're ever interested in getting some kind of replacement for your teeth, please come find us or ask your dentist to see if you are a good candidate for dental implants. So thank you for tuning in today. I hope that did answer some of your questions about why you may need a CBCT before you get an implant. We'll be continuing to answer some of your questions about all different kinds of things related to implants. So please stay tuned. Thank you.